Good afternoon. Welcome to the Human Services Committee meeting for April 16th, 2025. I'm Vice Chair Jen Ricketts-Swales filling in. Our chair may be here any minute. First on our agenda is roll call.
Mrs. Burdick, Mrs. Ricketts-Swales,
Here.
Mr. Barnes,
Present.
Mr. Bissett, Mrs. Hanchett,
Here.
Mr. Healy,
Here.
Mrs. Root. 5 present, 2 absent.
Next, can I have a motion for the approval of the minutes from March 19th?
Root will make that motion.
Thank you.
Hanchett will second.
Thank you. Is there any discussion of those minutes? If not, all in favor?
Aye.
Thank you. Next, we have Kimberly Common, Office of the Aging. I believe you're the accountant. Bear with me. You and I are doing this blind, Kim, so.
I am here to present the monthly report for the Office for the Aging. And there are a couple highlights on here. Our housekeeper chore, which is a state PC1 service, has increased from 683 that was this month last year to 754 this year. We are continuing to go out and do what we can to help people remain in their homes.
Kimberly, is that a volunteer program?
That one is not.
Okay.
PC1 services are provided by home care agencies, Jan and Bev's being the biggest one. And then we do also have 2 employees of the office who go out and perform that service. Yep. Our personal emergency response is also up from 153 units this month last year to 175 this month. That is the help I've fallen and can't get up button. Our tax program is just wrapping up. As of the 18th of March this year, we have received, gotten for our clients $251,000 in tax returns and saved approximately $48,200 in filing fees for seniors.
And
Go ahead.
that's volunteers to help with it.
Yes, the tax program is a volunteer-based program. Another one that we do have is, this one is not volunteer, but it is our GoGo Grandparent, which is relatively new. This is part of our transportation program, and we do have 57 rides scheduled with them at this point, just in the next few months.
And that one is volunteer.
Our volunteer transportation is separate from the GoGo Grandparent. We do get funding from New York State for the GoGo, and that is for people that just don't qualify for our volunteer program. If they have appointments in Buffalo, Rochester, this is a partnership that New York State started, so we can help those people too.
Thank you.
And that's all I have on the monthly report.
Okay. Next, we have the amendment to resolution number 17525.
Yep, this is just an incorrect entity name, and the language in the original resolution just needed to be amended.
Okay.
Healy will move it.
Hanchett will second.
Okay. Does anyone have any questions? If not, all in favor?
Aye.
Aye. Thank you. Okay, next is the accept and appropriation lifespan of Greater Rochester grant funds.
This is just a micro grant, $4,000 to support prevention and education of elder abuse in Allegheny County.
Root
Okay,
will make the motion.
thank you. Is there a second?
Healy will second.
Thank you. Any questions?
Madam Vice Chair,
Yes.
we also need included in this resolution the approval of the grant and approval of the chairman and board to sign the grant agreement as well.
Can you say that again? I'm
Yes.
sorry.
We also need included in the resolution approval of the grant agreement, the mini grant agreement, and then approval of the chairman of the board to sign
Okay,
the grant agreement.
okay.
Hanchett will move with the updates.
Thank you. Do I have a second?
Healy will second.
Okay. Are there any questions? If not, all in favor?
Aye.
Thank you. All right, next one is authorization to apply for the Accelerated Community Transportation Grant from the Health Foundation for Western and Central New York. And
Root will make that motion.
is there a second?
Delia, second.
Thank you. Any questions? All in favor? Aye. Thank you. Next up is the memorandum of understanding with the Allegheny County Community Opportunities and Rural Development, or Accord Corporation. I'm sorry, I can't keep up with my computer here, so give me just a second to catch up. Oop, went too far. Okay. So this is for the New York State Flexible Funding for Victims and Survivor of Domestic Violence Project. Is that correct?
Yes, yep, and this will, our portion of it is a partnership with Accord. Our portion will pertain directly to seniors who are victims of domestic violence.
Okay.
Hanchett will move.
Is there a
Root will
second?
second.
Thank you. Any questions? All in favor?
Aye.
All right. Now we have the permission for a lease agreement with the Bolivar Fire Department for the Bolivar Congregate Luncheon Site.
Root will make that motion.
Thank you.
Delia, second.
Thank you. Any questions?
Madam Vice Chairman,
Yes.
previously this year, the board passed resolution number 5425. I would make a request that, that this MOE be amended to make an amendment to resolution number 5425 to amend the term of the agreement from January 1st, 2025 through April 4th, 2025. And all the other terms and conditions of
Okay.
of the agreement would remain in full force and
Okay.
effect.
And then the other one takes over on April.
The new, right, and then, well, so we're, the
It's
office.
a different
for-
location,
It'd be a
right?
different location, and we'd have a
Yes.
different agreement.
Okay. And I don't have to repeat all of that, do I?
No.
Thank you. Do I have,
So can I go back and make my motion to reflect the changes that we just talked about then?
Yes.
Then I will do that.
And
Thank
I'll
you.
make my second to also reflect those changes.
thank you for helping me. Is there any other discussion? If not, all in favor?
Aye.
All righty. The next one is permission for a master service agreement with Finger Lakes IPA, doing business as Forward Leading IPA. And let me catch up one more time.
It's tough to keep up with just the acronyms.
I know. Okay, so this is the Social Care Network Lead Entity, or SCN Lead Entity.
This agreement allows us to provide services under the 1115 Medicaid waiver. We do have an agreement in force currently, but they have restructured the state, and now we are in the Finger Lakes region, not the Western region.
Gotcha. Okay, so we're moving regions.
Hanchett will move.
Thank you.
Root will second.
Thank you. Any questions? Yes, ma'am.
I didn't see the agreement in the packet, so I can't look it up myself, but I was curious what it means when it says there will be a limited fiscal impact. Is there a fiscal impact of any kind?
Essentially, it doesn't really hit the budget in any way. It's just that if we provide meals, they provide us funding for those meals. We don't do a whole lot of them.
Okay.
Are there any other questions? If not, all in favor?
Aye.
So moved. And then finally, we have a request to fill luncheon center manager position.
Yeah. This is in anticipation of a resignation that has been submitted, so we're just going to replace that one center manager.
Okay, and this is for Wellsville.
Yes, it is.
All righty.
Hanchett will move.
Thank you. Is there a second? Do I have a second?
Root will second.
Thank you. Any discussion? All in favor?
Aye.
So moved. Thank you.
Thank you very much.
Thank you for hanging out with me.
Anytime.
Next up, we have Tyler Shaw, and he's not new at this, so that should make it a little easier for me.
Good afternoon.
Good afternoon. Thank you for coming.
On the month report, just some highlights for you. We've been trying to incorporate some of the items that we're pushing out to the community. So you'll see some pictures in your packet. We did a model lead house at Belfast Central School, and we also had some lead education display boards for some of our local libraries. And the last picture is we're doing some community focus groups. So if you are interested in a particular topic that we're hosting, we encourage residents and anyone interested to register for our focus groups. Two other things that I have for you today. We are over 1,800 surveys completed for our community health assessment, which is an excellent accomplishment.
That's great.
And last but not least, we just got our letter yesterday for 2024, so we're a little behind on that data, and that's not surprising by any means, for tick surveillance. And I'll have Tiffany include this for the minutes. I have these papers for her. Deer tick populations were collected at two different sites in Allegheny County. One was Genesee Valley Greenway. The other was Hanging Bog. Although Hanging Bog, we weren't able to collect any ticks from that location. So Genesee Valley Greenway in the town of Canandaigua, they were able to collect 37 ticks. Over 67% came back with Lyme disease. 13% came back with anaplasmosis. 2.7% came back with babiosis. Again, these are just point in time. Doesn't mean it doesn't increase or decrease your risk in that particular area. That's just where they're collecting. They are planning to collect in several different areas across the county for 2025. Our relative risk score for tick-borne diseases across Chautauqua, Cattaraugus, and Allegheny is considered high regardless. So if you have a tick, try to remove it as fast as you can. Do your tick checks.
Was that a one time?
This was just one time, one point in time.
And what time of year was that?
This was, let me see here, I think it was October of last year. Yep.
Thank you.
Tyler, how do they go about doing these collections?
I wondered too.
Good question.
They just walk through the woods and then come back and shake the clothes, or
They
what?
have a specific cloth that they drag behind them along the trail path, and they typically travel a specified distance, and then they pick off how many ticks they collect. It's a white cloth, so they can pick those off. This was specifically for deer ticks only.
So I have another question. I saw today reading some stuff, and that there's a patch that they're trying to sell for people to put on their children to keep, and it was supposed to repel ticks. Is this like fake news?
I'll have to research it. I did not hear about that. I'm guessing it's some sort of DEET product. It is known if you spray yourself with DEET that it does repel ticks and mosquitoes. We do recommend that, but I haven't heard about the patch.
So what's the health ramifications of spraying yourself with DEET?
Well,
Depends on what risk you're willing to accept in terms of tick and mosquito bites.
That's what I thought.
Yeah.
Okay.
okay. Any other questions on the monthly report for Tyler? Okay, so you have MOE.
Yep, so first one is Family Resource Center Facility Use Agreement. We typically use these facilities for various health department programs, so this is just a renewal for the next year to utilize that facility.
Hanchett will move.
Do I have a second?
Root will second.
Thank you. Any questions? If not, can we vote? All in favor?
Aye.
Thank you.
Next up is Marco Technologies Agreement. This is for our printer copier at our WIC building in Wellsville.
Do I have a motion?
Root will make it.
Helios, second.
Thank you. Any questions? If not, all in favor?
Aye.
Thank you. Oh, look who wandered in.
Next up is preschool transportation contracts, and I have listed each of the school districts that we plan to contract with for transportation. I don't know do I have to read each one? Should I? They're listed in the MOE, but.
We can just do them all at once, though, right, if he reads them all? Okay.
Perfect. Alfred Allman Central School, Andover Central School, Arkport Central School, Belfast Central School, Bolivar Richburg, Canasarega, Canisteo Greenwood, Cuba Rushford, Fillmore, Friendship, Genesee Valley, Keshequa, Portville, Scioto, Wellsville, Whitesville, and Letchworth.
Helios, move it.
Thank you. Is there a second?
Root will second.
Anybody have any questions on that? I'm assuming the Keshequa one is some that are in Allegheny County, right, that go
Same with
that way?
Portville and Letchworth as well.
Yeah,
Yep,
okay.
Are these the same schools that we've had in the past?
that's correct. Yep.
Just been a long time program now, is that correct? And it's actually it's a money-saving program for the county,
Absolutely.
because we'd have to provide those services one way or the other, correct?
Yes, yeah. If we didn't have the school districts available, we'd have to contract with a third party.
Thank you.
Any other questions? All those in favor? Aye. Thank you. All right, now radon kits.
Yep. Just requesting acceptance and appropriation for a grant that we received from Allegheny County Area Foundation for radon test kits.
Okay,
Hanchett will move.
thank you.
Root will second.
Thank you. Questions?
Yep. Tyler, how many, this amount of money, how many radon kits will that buy us?
I think we're right around 297 to be exact. Yeah, and we're spending all that money is going towards test kits.
Do you have a lot of requests for these kits?
Not yet. We were in
I
anticipation.
see some social media out there promoting it.
Yep.
I just
so
didn't know if.
We're starting to lay the groundwork. yeah.
Okay, I didn't know if the residents themselves were requesting this.
Not yet. We're hopeful that we're working through some of our real estate agents, our real estate attorneys, so when properties
Good
do
idea.
sell, they can have that free radon test kit as
Is
well.
this something that's prevalent in this area?
Yes, we are a risk radon area. Yeah.
What makes us a high rate?
Typically, it's our geological rock formations, and that's what causes those the radon gas to seep into basements and living areas.
Okay, is it the porous? And this may be, is it the porous rocks that we have that, or is it the, we have a lot of sediment and mud that captures it? Do you know?
Typically, some of our shale rock
Shale.
formations. Yeah.
Okay, yep, that makes sense, thank you.
Interesting.
Radon doesn't kill ticks?
It doesn't. It doesn't. Apparently. Good question.
All in favor?
Aye.
The next one, are we tabling the next one?
Request to table. Yep.
Okay. So the next radon test kit funding donation is going to be tabled for now. You don't have to vote on that or anything, right?
You do have to do a motion and
Okay.
second to table and vote on it.
Can I have a motion for that, please?
Hanchett will move.
Barnes will second, okay. Any questions? All in favor?
Aye.
Thank you. Moving on.
Next is a request to amend Resolution 29324, and all we're doing is adding Southtowns Children's Associates PLLC for physical therapy services. We excluded them on the original resolution, that's all.
Okay,
You'll move it.
thank you. Second,
Root will second.
thank you. Questions? All in favor?
Aye.
Thank you. And then finally, is this also an MOE? Request to fill.
Yep, request to fill for our quality coordinator due to resignation.
Okay, so it was a resignation.
Yep.
All right, do I have a motion for that?
Root will make that motion.
Thank you,
Helio second.
thank you. Does anyone have any questions?
I just note this is 100% state funded, is it, or is that federal?
This is one of our federal grants.
Okay.
Yep.
Any other
100% federally funded.
Any other questions? All in favor?
Aye.
Thank you. Thank you, Tyler,
Thank you.
for helping me through that.
No problem. Anytime.
Next, we have Don Horn, Commissioner of Social Services. Don, you have to bear with me, even
No,
though,
that's okay. I kind of like the slow pace.
oh, thanks.
No. It gives me time to read everything.
I know, right? All right, so first up, we have your monthly report.
All of our numbers are pretty consistent. The one thing that I would like to point out on the second page, under the program integrity unit, the fraud unit. We did get two sizable settlements on two cases that we were pursuing. One was for $13,607, and the other one was for $5,720. So that number really jumped up for February to $27,000.
Wow.
So, are there any other questions?
Anything else on the monthly report? If not, we'll move on to, we have a contract.
Yes. This contract is for Together for Youth, and it's for our Pathways program. It's going to be a new contract for this year. We did budget for it. It is a preventive contract that is more intensive for children that need more attention and families that need more attention. Typically, under our normal preventive contracts, the contractor will go out maybe once a week or once every other week and do notes and recommend services. This contract will be a minimum of 2 times a week, and if the family needs more, they will go out more.
And will this be implemented by your department?
Yes.
Someone in your department? Okay.
Yeah.
Okay. We already have a motion on that. Okay. Can I have a motion on that, please?
Hanchett will move.
Root will second.
Thank you. Any other questions?
Yeah, Don, is this the first time, did I hear you say this is the first time you've done this contract?
Yes, this one is new to the county. I know that they have a model that they're using upstate that's very successful. And we're working with Together for Youth, who used to be Berkshire. And their after-school program is very, very successful. And this is a more intensive program for those children to prevent foster care.
About how many children do you think will be impacted by this contract?
The contract will cover 8 to 10 families every 8 months.
Okay, thank you.
Any other questions? All in favor?
Aye.
Thank you. Now, we're going to move on to the renewals of foster care, and Don's going to do all of them at once, and then we'll vote one time.
Yep. The renewal of the foster care contracts, they're all budgeted. The rates are set by the state by the maximum state aid rates. That's universal throughout upstate. So it will be for Buffalo Urban League, Catholic Charities and Diocese of Rochester, of Steuben and Livingston County, Kinship, Children and Family Services, Children's Home of Wyoming Conference, Gateway Longview, Glove House, Gustavus Adelphius Family Services, Hillside Children's Center, Kids Peace National Centers of North America, New Directions Youth and Family Services, Pathways, St. Anne's Institute, Together for Youth, the William George Agency for Children's Services, Villa of Hope Youth and Family Services.
Can I have a motion for those? Thank you.
Haley will second.
Thank you. Does anyone have any questions?
This is all, these services are all funded too, is that correct?
Yes,
Don?
based on the eligibility of the family when they come in, there's 2 funding streams for this.
So no anticipated county dollars involved.
There is county dollars associated with these, depending on the eligibility. So,
So we make up the difference.
yes.
All right, thank you.
The programs, like the one before, the Pathway program, though, is an attempt to try and keep some of those children out of foster care, correct?
Absolutely.
Yeah,
It's very, very expensive when they do
Right,
go in,
right.
so.
okay. Any other questions? All in favor?
Aye.
Thank you. And let's see. We have a request to fill,
Yep.
create and fill?
Yes, my secretary wants to retire. I tried to talk her out of it. She's been here for many, many years, probably 40. She'll leave with a lot of knowledge, and what I would like to do is create and fill a temporary position so the secretary can train the new person for all the knowledge that she has. I would prefer to take a wire and put it on her head and put it on the new person's head and maybe extract all that, but I don't think that's going to work.
So this will be a temporary create then?
Yes.
Okay,
Hanchett will move.
thank you. Is there a second?
Root will second.
Are there any questions? Go ahead, Mr. Barnes.
So this person that you're hiring is just a temporary?
No, they'll transition into the next request, and when the secretary retires, effective on that date, she'll move into the request to fill.
Essentially, we're hiring the next secretary.
Yes.
Okay, thank you.
Any other questions? If not, all in favor?
Aye.
Thank you. So the next one is another request to fill.
Right, which will be the permanent position of the curate and fill.
Root will make that motion.
Helio, second.
Any questions? So basically, this one will kind of be there, but won't be filled for a while because somebody's already in it.
Right.
Okay. Any other questions? All in favor?
Aye.
Thank you. And finally, to fill a senior casework.
Yes, this is due to a resignation. This senior caseworker is moving to another county department, and we need to fill her. This is in our CPS unit.
Okay,
Helio, move it.
thank you.
Hanchett will second.
Thank you. Any questions? All those in favor?
Aye.
Thank you. All good?
Okay.
I think that's it, isn't it,
Yep.
Don?
Yep.
All
Thank you.
right. Thank you. And certainly, last but not least, Dr. Anderson. Good afternoon, Dr. Anderson.
Good afternoon.
You, I believe, have a request to fill.
And at this point, I really am the least because I only have the one request. It's for an intensive case manager. We had a resignation, and we don't do well if we don't have care managers.
Exactly.
So,
Can I have a motion?
Hanchett will move.
Root will second.
Thank you. Anybody have any questions? This will be located in Wellsville, right?
correct.
Okay. Any other questions? All those in favor?
Aye.
There you go.
And if I might just, if you'd indulge me a moment, I'd like to prepare you for May being Mental Health Month. And we are, again, the Allegheny County Mental Health Association is sponsoring a luncheon training, and I will leave some of the forms, and you're certainly all really encouraged to attend it. And we'd like to see you there. Thank you.
Dr. Anderson, a quick question. And maybe I misinterpreted this, but I was on the Community Service Board meeting this past week, right? I'm sorry, I've been ill, so bear with me here, but I get the impression that some of the people were a little concerned about the potential of losing some funding. Was I right when I heard that, or they don't know, sort of, it's up in the air?
It's really up in the air, but I was on a meeting this morning when they were talking about the impact on OMH and OASAS, and I think people are wanting to be prepared, so they may be crying wolf.
Okay.
I don't think so, but they may be. If Medicaid gets cut coming in, then of course, all of the agencies that we have doing behavioral health will suffer tremendously. So, but it's really too late or too early to decide
No.
exactly what's going to happen. And with the New York State budget being late, I don't know that there's anything, certainly I don't think there's anything my department can do to hurry things up, so.
one of the things that struck me, and again, I was sick during this meeting, so, was I kept hearing them say that there were grants, but if the grant didn't go through, then they would have to pay all that money back. And that was concerning to me. It sounded like we were just not going to go for those grants then, right? Okay, that's what I,
There are a couple of grants, particularly out of OMH and OASIS, that you have the opportunity to get, I think the one that they were talking about was 115,000. But if you spent it and then the feds didn't come through with what they had promised they would do, then the state was going to take the money back from the not-for-profits.
right, okay. I wanted to make
pretty
sure I
serious.
understood that clearly.
Yes, you did.
Okay, thank you so much, I appreciate it.
Thank you. Thanks.
Okay, any unfinished business? Any new business? Anything good for the order? If not, can I have a motion to adjourn?
Root will make that motion.
Thank you.
Hanchett will second.
Thank you. All in favor? Aye. Thank you.